Hearing about a popular obesity and diabetes drug, Wegovy and Ozempic, a lot these days, and it's convincing some weight loss companies now to change their entire business models. Weight Watcher and Noom are now debuting plans where the people can get prescriptions for these kinds of drugs via telehealth. The FDA, though, is issuing a warning about these treatments. It's approved for diabetes and weight loss. They say both drugs have been on the FDA's drug shortage list since last year, and the FDA says when drug shortages happens, sometimes compounds or mixed versions of the drugs are prepared, and the agency hasn't reviewed those compounded versions for safety, effectiveness, or quality. To dive into this a little bit more, we have Dr. Angela Tran this morning. Good morning.
Good morning. How are you?
Good, good. Thank you for coming in. Okay, everyone's talking about this, right? It's like all over the headlines. We've got Real Housewives and celebrities all using it, right? And it's got people talking. What is it? Is this an injection, a pill? What is it?
Yeah, these are once weekly injections, but they are total game changers, and they actually treat both obesity and diabetes. Now, how they treat it is that they enhance your insulin effectiveness, but they also suppress your appetite and enhance your metabolism. In fact, as a medical weight loss doctor, I've seen patients lose over 15% body weight combined with the right diet and exercise plan.
Wait, but who is this really for?
Yeah, so these are FDA approved for both obesity and diabetic patients. So we have to be careful that it's not for someone who just needs to lose 5 pounds or, overall healthy otherwise. It's very important to work with a medical doctor who can identify, do you have insulin resistance? Do you have chronic weight problems that are associated with high blood pressure, diabetes, cholesterol, things like that?
So when we're talking about this shortage, I can assume it's because people who maybe don't meet the criteria are using it, and now you have too many people using it?
Yeah, it's very popular. And like I said, in my practice, it's legitimate and it works very well. In fact, it might even be more as an alternative to surgery, but you have to be careful because these are complex. They do come with side effects, and you need to work with a medical professional.
When they say compounded, which is the FDA's worry right now, what does that mean, and what is the concern? Yeah,
here's the problem is that compounding pharmacies are now creating copycat versions. Now, these ingredients are not the exact same as the ones in the branded ones. So the FDA did issue a warning for a reason, because these are considered unsafe. They may not even work anyways, and again, like I said, you really need to work with someone who just understands how to help you navigate so that you're staying safe with it.
And that becomes important, right? Because if everybody's trying to get their hands on it, and they're saying, oh, well, I'm seeing something that's kind of similar, but that's not the safe one to take.
Correct, yeah. And the problem is that it can be quite costly out of pocket, and that's why patients are looking for inexpensive versions. But like I said, you don't want to do a shortcut in this because these are medications that can be dangerous.
Well, what would you want people to take away from this? If this is something that they've been reading about or thinking about, what's your takeaway for them?
The good news is that there are more insurances that are covered, and that's great news. However, medications are mere a tool. You still need to have the right diet and exercise plan. We work with patients to help them understand, hey, guess what? You can use a medication to help, but you want long-term success, and so you don't want to be dependent on a medication forever.
Got it. Talk to your doctor, make sure you're being safe about it. Well, thank you for giving that perspective. I think that was something people needed to hear as they're reading all the headlines and things like that, so we appreciate it.
Yes, thank you.
All right, we'll be right back.